Hello, everyone who is watching. Thank you so much for joining Community Table Talk. I am very excited to be joined here with our friends from the Home and Community Care Support Services, so the former LIN. I have here with me today Danaka White and Liz Hastings-Cormier. Thank you so much for joining us, both of you.
Thanks for having us.
Thank you for having us.
Yeah, today we're going to be exploring some topics around long-term care options and some home care options for folks in community. And before we get started, I'd like to begin with a land acknowledgement. I'd like to say that the land on which I host this from today, so Waterloo region, is the land traditionally used by the Haudenosaunee, Anishinaabe, and Neutral people. I also acknowledge the enduring presence and deep traditional knowledge and philosophies of the Indigenous people with whom we share this land today. So without further ado, let's start with some conversations around home care. So just to get us started, Danaka, let's have a little bit more of a broad conversation. Just what are some of the services that seniors or folks in our community commonly access in terms of home care?
Okay, so for home and community care support services, we provide services of all ages. So we do have our pediatric caseloads who focus on our little kiddos and babies and all up into school age. So we provide services for kids who are going into the school system. And then we also provide services to young adults and into our seniors. So we offer a wide range of services in home, school, and community. We really want to ensure that we provide the right care at the right time and at the right place. So for all of our populations, anyone who's approaching home and community care support services, we want to ensure that we complete a really thorough assessment to truly understand what are the needs of the clients, what are the needs of their families and support systems, just to make sure that we're meeting the goals of their healthcare journey. So really that's where we offer that ongoing care coordination, just to ensure that we can adjust care plans as people do move through their healthcare journey. So in terms of home care support services, we do offer some professional services. So one of them being the most obvious is nursing. And nursing can look a little different. We have a variety of different types of nursing services. So we do have our community-based clinics where patients can go and receive their nursing care, and our clinics are all over Waterloo region. So we obviously want to make sure that when we are looking at nursing clinic support, that we can offer a nursing clinic that is close to where a patient may live, so they don't have to travel too far. We also offer in-home nursing support. So patients who are experiencing challenges of getting out and accessing community-based services, we do have an in-home nursing option for those patients. We also have our palliative care nursing. So our palliative care nurses really focus on that pain and symptom management for patients who have received a palliative diagnosis and require that type of support. And then we also have our rapid response nurses. So that's actually our in-home nursing team, and they really provide support for patients who have recently been diagnosed with chronic health conditions like congestive heart failure, COPD, diabetes, and they really work with patients on health teaching, learning about their new condition, making sure that they can self-manage that condition, and working with primary care in case there's any additional follow-up with medication adjustments, that sort of thing. So that really covers our nursing services. We also have personal support services as well. So our personal support services are really implemented to help support patients when they need assistance with activities of daily living. So that's really a fancy word for the day-to-day tasks that we do just to manage our personal hygiene and making sure that we're safe in the community. So our personal support workers, they provide assistance for patients who need assistance with dressing, who need assistance with bathing, if they are experience any physical limitations and need assistance with transferring, maybe in and out of bed. That's what our personal support workers are in place for, and support patients in their homes and in the community. We also have a variety of different therapy services as well. So some of our therapy services include occupational therapy and physiotherapy. We have in-home therapy services for patients who have experienced falls or who are at risk for falls. Perhaps they just experienced a long hospital stay and are deconditioned and can't necessarily access community-based therapy services. So that's when we would offer in-home therapy services to increase activity tolerance. And then further on, once we see an improvement, our therapists would then connect our patients to more community-based programs that they could participate long-term. Our in-home therapists also complete assessments for mobility devices. So that could range from walkers, scooters, and wheelchairs. So that is also a service that we offer. We also have nutrition services. So that would involve our patients who have perhaps just been recently prescribed a specialized diet and really don't necessarily know where to turn in terms of how to prepare food. So that could be patients who are on a minced diet or who possibly are new to a G-tube. So we have those nutritional services that assist with that. They can also provide assistance for patients who are new to insulin or perhaps are transitioning from a G-tube back to oral feeding as well. We also have our SLP who work quite closely with our nutrition services for swallowing assessments, communication techniques, and again, those are services that are offered in home if accessing community-based supports are challenging for patients. And again, we're really looking at those patients who cannot get out of their homes or possibly immunocompromised, so we'd want to offer those in-home supports. We also have social work. So we would look to our social work support for patients who are possibly living at risk in the community and need additional support to look at alternative living arrangements. They also offer support for arranging finances. So we do see a lot of times that we have patients who might not necessarily have family or supports in place to help sort out finances. So social work can assist with that and look for funding options for patients. They can also offer short-term intervention for any depression or mental health needs in the community. And again, part of their role will be looking at what are some longer sustainable community programs that those patients can also offer as well, knowing that our in-home social work supports are short-term in nature as well. We also have a pharmacy program that we can offer patients as well. So this is a really great program for a pharmacist to complete a med check and do some med teaching for our patients who have a long laundry list of medications. So it's really an opportunity to look at how can we simplify this for patients to be independent with medications, but then again, offer that teaching as well. So those are some of our in-home services, but we also work with system partners as well. So part of home and community care support services, as I sort of referenced before, is really understanding the needs of our patients and our caregivers in the community, looking to what can we offer in home, but where else can we meet the needs of our patients? So we've worked really, really hard to develop relationships with our system partners. And we also complete assessments and provide assistance with getting involved with different community programs. So some of those programs could be adult day programs, hospice care, respite care, caregiver support groups, looking to community support services that offer meal delivery or community dining, transportation services, friendly visiting, housekeeping services. So again, we're really looking at the broad picture of what can we offer in home, but also what's available in the community and providing that intense system navigation just to make sure that we can offer a robust care plan to patients to meet all of their needs.
Wow, that is so much more than I think people realize is a part of this agency. I mean, I find that sometimes with folks with complex needs or you know, trimorbidity or things like that, it can be very, very overwhelming to be thrown into that position and try to navigate the system. So it's wonderful to hear that there are so many programs and services available in-house in addition to those community connections as well. And I mean, I always encourage people, you know, if you don't know, just call. because it sounds like, there's so many connections through this organization that even if you're not sure where to go, somebody there probably knows.
Absolutely. And just to sort of touch on that, Danielle, is that we have care coordinators, and that really is their role in the system, is providing that intensive system navigation. Our healthcare system is not an easy one to navigate. Even working in the system myself, I am always reaching out to colleagues, asking questions, and they really are the experts and have worked hard to build relationships, again, with more community supports, and are really the experts in knowing where to guide clients at. And so care coordination in itself is a service, I think, that we offer to patients, but anyone who is on a caseload with home and community care support services and requires that ongoing care coordination, that is exactly their role, is that intensive system navigation.
Mm-hmm, mm-hmm. Yeah, and I guess this segues well into the next question of, if somebody is in need of these services, or a housing provider has identified that somebody in a building may struggle with some of the things that we talked about, they call you guys. Is there a cost for this service? Is there a wait list? What are some more information about the intake process there?
Sure. So I can maybe talk about how refer to enter our programs, and then also talk about cost and wait lists for sure. So the great news is we are open 365 days. We are open all the time from 8 until 8. We have our intake department who is available to answer live calls for people who want to refer themselves for an assessment for home and community care services. But we also receive referrals from primary care as well. Primary care physicians are well versed in terms of the home and community care supports that are available to their patients. And quite frequently we receive a large amount of referrals from primary care following an appointment with some of their patients who have indicated that they're struggling in the community. So that's definitely an avenue where many people can access our home and community care support services. Some of the community and system partners that I referenced, such as Adult Day Program or caregiver support, such as Alzheimer's Society, they can also refer patients. They build relationships with patients, and just through their interactions, they can always make a referral or support a patient and referring themselves to our services as well. So I think the most important thing is that our door is always open, and there's multiple ways of how you can get connected to home and community care support services. So following a referral to home and community care support services, which would indicate that an assessment is required by a care coordinator, that would really be the next step. So you would be assessed by either our intake care coordinator, or I forgot to mention too, some people can get connected to home and community care support services through the hospital. If they've just experienced a hospital stay, we have care coordinators that work in the hospital that can initiate that referral and assess a patient right at the hospital, so they can set their services up to support a seamless transition home to the community. So really the important thing is that our care coordinators complete that assessment and really understand the needs of the patient to develop that care plan, and understanding that patients' needs change as time goes on, and that's where that care coordinator comes into place to change that care plan, to increase services, or if a patient's improved, to decrease the amount of services that they need and connect them to community-based services. So you asked about the cost. So we are funded through the Ontario government. So our home and community care services are covered, and there's no additional cost to patients. But want to also recognize as well is that for some of our community-based programs, so when I referenced Adult Day Program or overnight respite, there is client co-payments attached to that, as well as some of our other community-based programs for transportation services or meal delivery. So many of our programs do have subsidies available for patients who may be experiencing some challenges with paying for some of the services, but there are some co-payments. But we will work with patients. We will try our very best to look at different funding avenues if that is identified as a barrier our goal is to make sure that patients live happy, healthy lives in the community. And so we have done some pretty amazing work for some of our patients who possibly are new to Canada and are still waiting for citizenship or for government assistance. So we have done, we look at barriers and we look at how can we break them down just to ensure that patients receive the care and support that they need.
Mm-hmm, mm-hmm. And I like that you brought up just identifying some of those barriers, because, you know, even just the overwhelming amount of work it takes to do this care coordination on your own is a huge barrier for folks. And if, you know, if someone is new to Canada and needs translation services, or, you know, if it's somebody who may not be literate or, you know, may have a developmental delay, this is so helpful in making sure that person can navigate this system in a way that, you know, still provides dignity and autonomy over what care that they receive.
Absolutely. And it really goes back to that system navigation role with care coordination. We've built relationships with multicultural societies and interpretation services, the Canadian hearing services. So we really lean on them when it comes to barriers and working together to address those barriers for our clients.
Mm-hmm. Yeah, that's so wonderful. And, you know, there's been lots of positive experiences that I've heard, you know, folks that have come out of hospital and are accessing OT services or need assessments done for accessibility purposes. You know, just it seems like that one-stop shop, which is so desperately needed when the healthcare system it can be convoluted at times.
Absolutely. And one of the other opportunities that I just wanted to mention as well, in speaking about barriers, is that we do listen to our community partners as well. And over the last couple of years, we're talking about challenges with accessing services in the community, is we heard loud and clear from primary care physicians in our region around, we have been seeing an increase in refugees settling in Waterloo region, and that they have had ongoing challenges with accessing healthcare services as well. And respectfully so. I mean, there are language challenges. This is a culture shock. So we actually, we were able to develop a role that was dedicated to refugee health as well. And it was really that intensive system navigation to support refugee patients in accessing healthcare services as well. And we're really hoping to do more of that, really understanding for our residents in our area, where are they experiencing challenges, and what are those patient populations that we can do a little bit more for, and really understanding what those unique challenges are. So I'm excited to see how the role of the care coordinator continues to evolve to address those patient populations as well.
Absolutely, absolutely. So now that we've talked a bit about home care, I'd also like to touch a little bit more on long-term care, which is, I think, where Liz is coming into this equation. Is there anything else that you would like to say about, you know, connecting folks to necessary supports or finding appropriate services? Anything that we haven't touched on yet?
I think I covered it all. I'll probably watch this again and go, oh, darn it, I missed something. And I didn't mention around long-term care because I knew Liz was going to be chatting about that, but that's definitely another service that care coordinators offer as well, is completing the assessment for long-term care eligibility. But that's all I'm going to say. I don't want to steal Liz's thunder, so she's the expert on long-term care.
All right, sounds good. Well then, Liz, I think we'll transition over to your piece here. That's okay with you. So yeah, let's talk a bit about folks who need more intensive supports than what our home care can offer.
That's right. So, you know, many times we'll come to a place where we wonder, do our seniors, or are they ready for admission to long-term care? So some of the questions that often come up is, you know, how do we counsel about that? How do we start the conversation? How do we go to the application? And then what's next? So in finding the right place to live, some of the options are often retirement homes, assisted living, there's long-term care, there's also residential hospice. So part of the care coordinator will help navigate with that individual to determine which one is the right place. A retirement home is one If they are a true retirement home, they'll be regulated under the RHRA. They'll be licensed. Assisted living will be usually through municipality. They have lengthy wait lists. And a long-term care home is actually legislated by the province and licensed by the province. So there's a very rigorous process to become a long-term care home. They can be municipal, they can be private, they can be standalone. There's all types of different kinds of long-term care homes that exist. So what happens at a long-term care home? In a long-term care home, generally all your meals will be covered. There's 24-hour supervision and nursing. You'll get help with all of your eating and grooming, all of your regular and emergency care. There's recreation programs, laundry service. So, you know, when you think about, is it time for me to think about long-term care or to talk about it, is the person is leaning towards needing that care and supervision 24 hours a day. Our care coordinators, when they're referred to talk to somebody about that, they'll talk to them about where are you in this continuum, and talk to them about how does this look for them about moving through. And they'll also go through a whole application process. It includes doing a health assessment. There's a very comprehensive assessment process that they go through with the senior. Now, one of the questions is, well, how do I make that decision? How is it? It's really tough to make that determination. So I tried to kind of separate out from the person's perspective and then also the individual who's working with the individual. So if from the person perspective, well, they might be forgetting things quite a bit. It might be important things like medications. It might be my spouse just passed away and all my support systems are not there as the way I would desire. It might be that I'm the caregiver and I'm looking after somebody and it's just I'm totally burnt out. It could be that it takes me so long to get ready in the morning that I just can't manage anymore. And when I'm getting ready, I'm falling. I'm really at huge risk. Or if I'm looking after somebody and somebody's just not recognizing this for themselves, I'm seeing all of these risky things that might be happening. I'm seeing them falling. I'm seeing them taking care of themselves, but they're really at high risk, but they're not really recognizing it for themselves. So I need to help them talk through that. I'm seeing a lot more visits to primary care, or they're visiting the emergency department maybe 3 times a month, or maybe just increasing visits. Their caregiver is showing health decline, or they're showing signs of burnout. They're not really well linked, or they're showing signs of failure to thrive. They can't manage their day-to-day functions. These are some key things that we would look for in that individual. Another thing, you know, is how would you determine if that person is ready to have a conversation, or how do I have that conversation? Well, it's a really hard conversation to have. If you're not used to, our care coordinators are very adept at having that conversation, but if you're wondering from your perspective as a provider or somebody who's looking after that individual, it is very hard to get that conversational ball going. But it's really about you're approaching that individual with support and you're being very empathetic, wondering about how they're feeling in their current situation and really trying to suss that out. So I've kind of sussed out an example of how we might have that conversation with an individual. We might give an example of, hey, I've noticed you've been having this problem. So in this example, I've said, Mrs. Jones, I've noticed you've gone to the hospital quite a few times in the last few months. How are you feeling about this situation? So trying to get that feedback from the individual to say, do they perceive that they have a problem? And how do they feel about, do they feel like they're ready to move into another environment? And then we can provide some feedback to them to say, I'm worried about you. How would you feel like it's okay if we start the conversation about living in another space? And then that would be where you would make a referral to us, Home and Community Care Support Services, and that used to be us. We used to be called the LIN. So eligibility for long-term care, to make that referral, some key things is you have to be at least 18, you have to have a health card, you need to have fairly frequent intervals of care that's required, or a caregiver that's not needed. And you have to have one of these 3 items here: nursing care, care with your activities of daily living, and on-site supervision needed. One of the things I'll say is, it used to be in the past that you would apply just in case, or just to get your name on the wait list. That's not something that happens anymore. You do have to apply if you're ready to go. So you have to be prepared to move into that long-term care home on the day that you apply. So for the application process, the care coordinator will come out. They'll do an application of eligibility. Before making you eligible, they'll make sure that they've reviewed all of the options in the community to ensure you're lifted up to be able to manage as well as possible. They'll go through a fairly lengthy application process, and they'll ask you to try and review homes. Now, here we've said they'll try and get you to tour homes. Obviously, right now, our current circumstances make that very challenging. Some homes have virtual tours or those types of things. They'll try and steer you to options that might make it possible for you to do that. And then once all of those steps are complete, your application will be sent to the long-term care to consider. Once that's done, the home will review your application and hopefully put you onto the wait list. We have a directory of that wait list, and you can find that online as well. There's a whole host of information that the care coordinator will help navigate to. We can also help you through that too as well. On WW Healthline, there is a whole list of all of the long-term care homes that are in our region, and it also has some waitlist information as well. There are 3 types of bed types that are in long-term care. You have a basic, semi-private, and private. A basic means that you could share, right now under the current regulations, there's no more than 2 people in that room, but it's how it's laid out, it will be different. There's semi-private, there are 2 beds per room, and there's private, only 1 person. The fees for those rooms have been frozen since 2019. They haven't changed it during the pandemic. A basic rate is about $18.91, semi-private is $22.80, and private is $27.80. Basic you can apply for a subsidy for, so there is some financial assistance that it may be available in circumstances. There's no subsidies available for the other types of beds. So these are the different programs that might be available to you if you do. One important factor is to make sure that you always have your most recent taxes that are done. So there is a wait list for long-term care. So it is important when you're ready for long-term care, you apply, but you could always expect that there will be a wait list for that home. The homes will assess you, and the Home and Community Care Support Services is responsible for reviewing those wait lists on a regular basis and making sure that as soon as that person is ready, they will be presented to that home to be considered for the next available bed. There are some specialty beds that are out there. They're called veterans beds or priority access beds for a spousal reunion, those types of things. So those exist. And we'll be sharing the slide decks because I know we're going quickly because of our time. And then, so what do you do once you've been accepted into a long-term care home? You're going to wait for your bed. Once you do get your bed offer, you'll be asked to move in fairly quickly. And basically, you're going to ask that person to just take an overnight bag, and then over days, you'll move in the items that you really, really want to have. In a long-term care home, generally, you don't have to take, you can do an offer. So if I'm going to a long-term care or making my long-term care list, I can choose up to 5 homes in general. So that second bullet point where it says the offer is not your first choice, if I've chosen 5 homes, I could go to a long-term care home that if I've chosen 5, I could go to choice number 2 or 3 and then wait for a choice of a preferred home eventually, depending on how quickly I want to get into long-term care. And then when you move, you'll give all kinds of information on moving day and important information. And then when you settle in, they'll spend the day getting to know you, getting some more information about what it's like to settle into that home. They'll get all your financial information, get everything set up. You'll need a void check. You'll need all kinds of good information to get settled into the home. And then you have some rights and choices. So there's personal health information. There is, you'll need to make sure that you send all of the, we will be sharing personal information with the home. So these are all parts of the record that we share with the home. I want to just move on, just because of our time, to the last slide. There is some information about how you escalate. So we have some patient relations. There's an action line. Okay, so what has changed in the pandemic related to the long-term care application? There has been some changes in the legislation. These changes are related to the operations of how the care coordinator will process the documents related to long-term care. It also has affected the flow and how patients enter long-term care. One of the things that the care coordinators can do is that they can do more virtual assessments that help support the application. And now applicants, there's a lot of care in supporting patients' entrance into long-term care to help protect residents from COVID and spreading that virus in homes. So what that means is that they will be tested for COVID-19 before they enter homes. Depending on their COVID status or their vaccination status, there will be some isolation and testing related to that, and their status will affect the length of their isolation. Now, these directives are guided by something called Directive Number 3. And Directive Number 3 is constantly changing based on science and best practices. So honestly, we had one 2 weeks ago and I've got a new one today. So it does change very frequently. So we will see changes in those frequently. So it's best to look directly at the directive for the most recent information. Care coordinators we're informing them of what these changes are, and they're counseling the patients and families on this is what's changed, this is what's happened, this is what you can expect on your admission for your upcoming admission. So they're really helping these patients and families as they're moving through their admission time. Now, the directive and these pandemic changes certainly has affected the timelines around what it looks like to get into long-term care. It has slowed things down because there has been some closure of beds related to not crowding people in. We used to have 3 and 4 bed wards, but they want to make sure there's enough space to avoid infection. So they've made sure that there's a reduction in that risk, but that also means there's a few fewer beds in the system, and they're working very hard to open spaces. In the meantime, there will be a little bit of a backlog while we work through that. So it's a work in progress, but we are working towards a resolution on that. So that's the waitlist status. The other thing about wait times is the time that they move into the home. There are some legislation and things that they might have read about in some of the pamphlets and things that we're circulating, but all of those are changed because of that Directive 3 we spoke about before. That means when you have your COVID swab and when you have your immunization, you have to move in right away. That's to reduce the risk to the home and make sure everybody is safe when they move in. One thing that's important is to make that extra space. They've reduced programs like short stay respite. That's to increase the space and make those beds long stay. So some of those programs that you might have relied on and used before are not available right now. And visiting guidelines are often affected when community infection rates are high. So right now we're in a great space here in May where visiting guidelines are opening back up, but should infection rates increase again, they will put those protective measures around long-term care again and reduce those again. So that's something that could be variable. So those are some pandemic related items to consider. So that's the very quick Coles notes. When we're counseling a family, it does take actually days and sometimes weeks to do all of the counseling related to long-term care. It's a very complicated subject. It's not something you learn very quickly or fast. So the important takeaways here is what does it take, or when are the triggers that I should consider this conversation? And then the other part is bring us in early and ask the question, and we'll help you navigate through.
Thank you so much, Liz, for that. That's a lot of really wonderful information and is quite comprehensive for folks who maybe haven't had to navigate the system before. And I really want to highlight one of the things in your slides, which was how to approach these conversations with folks respectfully and compassionately. I think sometimes if we are a housing provider, or if we are somebody providing primary care, then we can have that caregiver burnout or that emotional exhaustion. And it's so easy to just see someone and go, you should know that you shouldn't be living independently. Come on, like, let's go. And just making sure that we are checking ourselves of those biases and recognizing that this has a ton to do with someone's identity and autonomy and feelings of self-worth.
Absolutely, 100%. And I think that's really important to remember, is that it's about the self-recognition of I may not want to give up that independence, and it may be that because that desire is so strong, I'm not willing to recognize what might be right in front of me, and everybody is so clear to everyone else. So it's a struggle to recognize that for oneself.
Absolutely. And I think it's worth noting too that if it is a housing provider or a caregiver or a family member, reaching out to someone like your organization with your care coordinators or intake, or somebody like myself, which is just that liaison position who has, you know, a knowledge of community resources and that mental health piece, and just getting some advice. Because sometimes when we talk to an agency externally and go, hey, this is the situation, how do I approach this? It can ground us, it can give us new ideas on how to approach it, and overall the outcome is just so much more productive and safe for everyone.
For sure.
Happy
to support the conversation anytime.
I see our time together is wrapping up, but is there anything, Danaka, Liz, that we haven't covered that you want to say?
Just thank you. I think that this is a really great platform to get the message out there, and just to inform residents in our community sort of what's available out there if they are struggling in the community. So hoping to receive a few phone calls and self-referrals or referrals from primary care, just so we can serve more patients.
Absolutely. Thank you for the opportunity.
Yes, thank you both so much for taking the time out of your days to have this conversation with us. So on YouTube, I will upload a link to the Home and Community Care Support Services website and have that phone number available, as well as on the housing provider portal. I will have that slide deck that Liz went through if you're looking for more information, or if you are just a visual learner and prefer to take it in that way. But yeah.